Have you ever found yourself just, doing something on autopilot? Like maybe you always grab the same coffee brand, or
Mhm.
you just know a doctor's recommendation is right, even without really digging into it yourself?
Yeah, definitely. It feels like something's guiding you, doesn't it?
Exactly. It's like some unseen force is nudging us. Well, welcome to the deep dive. We're your shortcut to getting well informed on topics where psychology, economics, and the real world collide, especially somewhere critical like healthcare. And today, we're embarking on a really insightful deep dive. We're looking into a groundbreaking book, The Agile Network, a model to foster innovation, implementation, and diffusion in healthcare settings.
That's a significant
It
one.
really is. It's by Dr. Malaz Boustani, who's a distinguished professor at Indiana University, and his co-authors, Richard J. Holden, PhD, Jose Azar, MD, and Craig A. Solid, PhD. Quite the team.
Absolutely. A lot of expertise there.
Our mission, then, is to unpack some really key insights from the fourth section of their book, specifically pages 49 to 58. This is where they dive into behavioral economics, how our behavior, often totally unconscious, really shapes our decisions in complex places like healthcare.
It's fascinating stuff.
Totally. We're going to explore why understanding this is just vital for transforming care, and maybe even more importantly, how you can use these ideas to make better choices yourself. Get ready for some, like, aha moments about your own brain.
Looking forward to it.
Okay, so we like to think we're perfectly rational, right? Especially for big decisions, health
Uh,
decisions, we think we weigh everything up.
yeah, the ideal logical decision maker.
But the Agile network kind of pushes back on that, doesn't it? What do they suggest?
Well, what's really fascinating is how behavioral economics, and it lines up with things like network science and complexity science too.
Mm.
It shows that, yeah, human behavior is adaptive, but it's also deeply, profoundly shaped by our immediate environment,
Yeah.
our social setting, the physical space.
Mm-hmm.
It's rarely this purely logical step-by-step process we imagine.
So not just cold, hard logic. That makes me think of Herbert Simon's idea, bounded rationality, which the authors bring up. What does that actually mean for our day-to-day choices if we're not perfectly rational?
Bounded rationality, it basically means our decisions are about as rational as they can be given our real human limits.
Limits like what?
Well, think about it. Our attention spans aren't infinite.
Right?
We only have so much time. Our memory isn't perfect. We just don't have unlimited mental resources to gather and process every single scrap of information.
Got it. So our rationality is bounded. It works within those limits.
Exactly. And because of that, we take mental shortcuts.
Ah, shortcuts. And that's key to understanding how we operate, isn't it? This sounds like the famous System 1 and System 2 thinking from Amos Tversky and Daniel Kahneman. Can you kind of break those down for us?
Absolutely. So think of system one as your brain's autopilot. It's fast, it's automatic, really intuitive,
Like a gut reaction.
exactly like a gut reaction.
Right.
Great for quick judgments, doesn't take much mental effort, and it's often triggered unconsciously by things around us.
Okay. And System 2.
System two is the opposite. It's slow, very deliberate, and it eats up mental resources. It's like your brain really, buckling down to meticulously solve a hard math problem.
Huh.
Requires focus, conscious
Yeah.
effort.
But the book makes a point that System 1 isn't necessarily bad, is it? In fact, it can be what makes experts here.
Precisely. The decision scientist Gary Klein, his work really highlighted this. Professionals like, say, experienced firefighters or soldiers in combat or ICU nurses, they rely heavily on System 1 speed and reflexivity.
Mm-hmm.
It lets them make fast, effective decisions in really high-stakes, time-crunched situations, often without all the information.
Okay.
But the irony is most of us really underestimate how much we lean on System 1. We tend to assume our choices are always the result of that slow, careful System 2 deliberation.
Interesting. So because System 1 is built for speed and often works with incomplete data, it uses these mental shortcuts.
Heuristics, right?
That's a term, yes.
Yeah.
Heuristic. And while they're super efficient most of the time, sometimes
Yeah.
they can lead us into predictable, kind of irrational errors.
Exactly. That's where the biases come in.
Yeah.
And this is where it gets really, really interesting.
Okay, let's dive into some specific examples. What's one of the big ones?
One of the most powerful is definitely anchoring.
Anchoring.
It's our tendency to just latch on to the very first piece of information we get. That becomes our starting point, our anchor,
Even if it's totally random.
even if it's completely arbitrary or irrelevant. Think about that classic experiment Tversky and Kahneman did with the UN.
Oh, yeah, the wheel.
That's the one. They spun a wheel, rigged to land on either 10 or 65. Then they asked people to estimate the percentage of African nations in the UN.
Ah.
Get this.
Mm.
The people who saw the number 10 guessed around 25% on average. Those who saw 65, they guessed way higher, around 45%.
Yeah.
That initial number, that anchor, just dramatically pulled their estimates.
Wow. That's pretty wild. So the takeaway for you, the listener, is maybe don't just accept the first number thrown at you.
Absolutely. Question that initial anchor. Whether it's a price tag, a doctor's estimate, whatever, look for other information to make your own judgment.
Makes sense. Okay, what about availability? How does that one work? How does remembering stuff easily bias us?
Right, the availability heuristic.
Mm.
This kicks in when we judge how likely something is based purely on how easily we can recall examples of it.
Okay, so
Like, if your city just had a really memorable tornado, you might unconsciously think the chance of the next storm turning into one is higher than it actually is, just because the memory is so fresh and vivid.
okay. Or like seeing lots of news about something scary.
Exactly. If you've just seen intense news coverage of, say, a public shooting, you might feel more anxious in crowded places afterwards. The event is readily available in your mind, even if the statistical risk hasn't changed. It skews your perception of probability.
So the trick there is to consciously challenge that gut feeling if it's based on something really recent or vivid.
Precisely. Try to step back and maybe look for broader data, not just rely on what pops into your head first.
Got it. What about representativeness?
Representativeness that involves making quick comparisons to a mental model or stereotype we hold.
How so?
Well, imagine someone tells you what they do for a living, but they don't really fit the picture you have in your head of someone in that job. You might feel surprised, right?
Yeah, okay.
In medicine, doctor might assess how likely a diagnosis is by comparing a patient's symptoms to their mental prototype of someone with that disease. It's efficient, sure, but it could also mean they might overlook less common diagnoses if the patient doesn't neatly fit the mold.
So be aware of snap judgments based on stereotypes. Look at the individual details, not just the category.
That's the idea.
Okay, next up, gains and losses, or as the book calls it, loss aversion. This feels like a really deep-seated one.
Oh, it absolutely is. Loss aversion is huge. Basically, people hate losing something about twice as much as they enjoy gaining something of equal value.
Twice as much. Wow.
Yeah, the research consistently points to roughly a 2.1 ratio. It's why things like free trials or money-back guarantees are so effective.
Because once you have it.
Exactly. Once you possess something, even temporarily, you assign it more value. Losing it feels worse. If you've ever bought something thinking, oh, I can just return it, but then after a month, getting the money back feels less appealing than keeping the item. That's loss aversion biting.
I think we've all been there. That feels like it connects directly to the status quo bias, too.
It really does. They're closely linked. The status quo heuristic is just our general powerful tendency to stick with how things are right now, the current arrangement.
Like sitting in the same seat every day.
Yep, like sitting at the same table in the cafeteria even when other seats are free.
Right.
Or think about how much of a hassle it feels like to change your phone plan or your bank, even if you suspect there's a better deal out there.
Right. It's just easier not to.
It's the path of least resistance. TV networks know this. They'll schedule a popular show right before the late news because viewers are just more likely to stay put on that channel.
So the insight there is maybe actively challenge your defaults sometimes. Don't just coast.
Definitely. Ask yourself, is this still the best option? Or am I just sticking with it because it's easy? It takes a little effort, but it can be worth it.
Okay, then there's framing. This sounds like it's all about presentation.
It is entirely about presentation. Framing shows how incredibly sensitive we are to how information is presented, even when the underlying facts are identical.
Give me an example.
Okay, the classic medical one. Patients are much more likely to agree to a procedure if they're told it has a 90% survival rate compared to being told it has a 10% mortality rate.
Even though it's the exact same outcome.
Exactly the same. But one frame sounds positive, the other negative. Marketers use this constantly. You see beef labeled 95% lean, not 5% fat.
Right.
Our fast-thinking system one just takes the easy route. It doesn't automatically do the mental math to figure out the equivalent statement.
So always try to flip the frame. If something sounds really good or really bad, see how it sounds the other way around.
That's a great practical tip, yes. Always reframe it in your mind.
Okay, one more. Priming. This one sounds subtle.
It is very subtle, but also very powerful. Priming means that just being exposed to a certain word or an image or an idea can influence your later thoughts and actions, often completely without you realizing it.
Really? How does that work?
Well, research shows that simply asking someone if they plan to get a flu shot actually increases the chance that they will get one.
Just asking.
Just asking. It brings the idea to the front of their mind. Environmental cues work too. Like if you see the elevator right before you see the stairs, you might be subtly primed to take the elevator.
Ah, or signs about washing hands.
Exactly. Putting up posters about hand washing in a cafeteria makes it more likely people will actually remember to wash their hands before they eat. These nudges are subtle, but they tap right into our unconscious processing.
That's kind of mind-blowing. So be aware of the cues in your environment. They might be steering you more than you think.
Definitely worth paying attention to.
Okay, so we've got all these biases, all this system one thinking going on under the surface. What does this all mean for us, in our daily lives? And especially in a complex world like healthcare, the authors of the Agile Network actually bring this home really well using Tommy's story, which they introduced earlier in the book. You might recall Tommy, he was well-informed, even had a doctor's son-in-law.
Right, but he ended up having an unnecessary surgery with complications.
Exactly. How does his story illustrate these biases?
Well, if you look back, Tommy's decision to go for the surgery, even when his family was advising against it, seems heavily influenced by these things. His friend had recently had a stroke, right?
Yeah.
That likely primed him about how serious strokes are, and the memory was highly available in his mind. That probably skewed his perception of his own risk.
Okay.
Then you add in the fact that the first doctors he saw, the ones recommending surgery, were figures of authority. That anchors his thinking. The combined effect of these heuristics was just stronger than his family's logical arguments for other options.
So his system one was already kind of convinced?
It seems so. It was convinced by these subtle environmental cues, the recent events, the authority figures, verbal reasoning, System 2 stuff from his family, just couldn't compete effectively with the choice architecture he was already in.
Wow. That really highlights the challenge. So this raises a massive question, right? If System 1 is so dominant, especially when doctors and nurses are short on time and information, how can we possibly encourage better decisions and behaviors for better health outcomes?
That's the million-dollar question. And the authors propose a really smart solution. Instead of trying to force everyone into slow, effortful System 2 thinking all the time, which often just isn't practical in busy healthcare settings.
Right, it's not feasible.
They suggest adjusting the system itself, changing the characteristics of the complex adaptive network, the interactions, the physical spaces, the social norms, to gently influence System 1 in the right direction.
And that's where nudges and choice architectures come in.
Exactly. That's the core idea.
Okay, so break it down. If I want to influence behavior positively, what exactly is a nudge in this context? Can you give an example again?
Sure. A nudge is basically an intentional, small tweak to one part of a process or the environment. We mentioned free trials. That's a nudge using loss aversion.
Okay.
Or think about grocery stores putting healthier food options right at eye level. That's a nudge. It doesn't forbid buying junk food. It just makes the healthier choice slightly easier, more visible.
Gotcha. Simple, subtle changes. So how do we design these effectively, maybe in a hospital setting?
Well, you first figure out which specific heuristic or bias you want to tap into. Then you design a situation that leverages it.
Okay,
Like knowing priming works, you can maybe redesign a staff break room or place coffee stations strategically to encourage more informal chats between people from different departments, more interaction, more sharing of ideas.
makes sense.
Or to use the availability heuristic, maybe during daily team huddles, you briefly mentioned a recent near miss or adverse event, not to blame, but to keep safety top of mind.
Keeping it available.
Exactly. And since we know loss aversion is stronger than wanting gains, you could structure team incentives around avoiding a negative outcome and frame it that way, rather than just focusing on achieving a positive one.
Interesting. So when do nudges work best? Are there specific situations?
Yeah, they tend to be most effective when the feedback loop is long. Like a nurse might not see the negative consequences of poor discharge instructions for weeks, if ever. A nudge at the point of discharge can help bridge that gap.
Right.
They're also great when people have limited experience or knowledge about an action or its consequences. That's when System 1 really takes over, and a nudge can help guide it.
Okay, so nudges are these individual adjustments. What about a choice architecture? How's that different?
Think of a choice architecture as the whole environment, the entire system of nudges working together. It's about designing the context in which choices are made to promote a whole series of desired decisions and behaviors.
So multiple nudges combined.
Yes, and it includes things like setting smart default options. For example, making organ donation the default where you have to actively opt out dramatically increases donation rates compared to requiring people to opt in.
Because opting out takes effort, taps into status quo bias.
Exactly. It also involves using established conventions like universally understood color codes. Green means go, or safe, or positive. Red means stop, or danger, or warning. System 1 gets those instantly without needing to think.
Clever. But there's a really important ethical line here, right? Nudges can't be manipulative mandates.
Absolutely crucial point. A true nudge must be easy to avoid. People have to remain free to choose otherwise. If it's coercive, it's not a nudge. They work best when they're integrated seamlessly, working on our automatic System 1 without necessarily triggering suspicion or resistance. When you combine these behavioral economic insights with network science, like the book does, you get this incredibly powerful framework. It helps us understand how ideas and better practices actually spread or don't spread within complex systems like healthcare. And that really sets the stage for making transformation happen more effectively, more agilely.
Fantastic. So just to recap today's deep dive, we've explored this fascinating world of behavioral economics, guided by the brilliant work in the Agile network by Dr. Malaz, Boustani, and his co-authors Holden, Azar, and Solid. We've seen how our brains use these super efficient shortcuts, how those heuristics can sometimes lead to biases like anchoring, availability, framing, loss aversion.
All those cognitive quirks.
Right. And why understanding these very human tendencies is just absolutely essential if we want to improve complex systems like healthcare delivery or really any system involving human decisions. So here's something to think about. Next time you make a quick choice, or you notice how something is designed or presented in your environment, maybe at work, maybe at the store, pause for a second. Ask yourself, is there a nudge here?
Good question to ask.
Am I running on System 1? And is it actually steering me toward the best outcome? How can you, knowing this now, be more aware in your own life? Or maybe even advocate for better, more thoughtful choice architectures in the systems that affect you?
Yeah. How can we use this knowledge?
Because understanding this isn't just about receiving information passively. It empowers you to engage critically with the world and maybe even help shape a more compassionate, effective, and human-centered healthcare system and beyond.